Certainly. Here's a simple guide to the Korean healthcare system for expats. Overview of the Korean healthcare system. South Korea has a highly efficient and advanced healthcare system. It combines public insurance, national health insurance, or NHI, and private healthcare providers, ensuring affordable and quality care for residents, including expats. 1. National Health Insurance (NHI). The National Health Insurance is a universal public health insurance system that covers the majority of healthcare costs in South Korea. It's available to both Korean citizens and foreigners who are residents. How to join NHI. For expats with employment, if you work in Korea, you'll be automatically enrolled in the NHI through your employer. Both you and your employer contribute to the insurance. For expats without employment, if you're self-employed or a dependent of someone who works in Korea, you must apply for NHI at your local National Health Insurance Service (NHIS) branch. Foreign residents on long-term visas are required to join NHI. After 6 months of residence in Korea. Cost of NHI. Employee contribution. If you're employed, the NHI premium is typically about 6.9% of your salary. Both you and your employer share the cost equally, i.e., 3.45% each. Self-employed contribution. If you're self-employed, you'll be required to pay based on your income level. What NHI covers. NHI provides comprehensive coverage, including doctor's visits, general practitioners, specialists, hospital stays including surgeries, medications at pharmacies, preventive services like vaccinations and cancer screenings, emergency care. However, some cosmetic procedures, dental care, and certain alternative treatments may not be fully covered. 2. Private health insurance. While NHI covers most medical needs, many expats opt for additional private health insurance to cover gaps or to receive faster, more comfortable care. Why consider private health insurance? Faster service. Private health insurance often allows quicker access to high-quality hospitals. Comprehensive coverage. Private insurance can cover dental care, vision care, and cosmetic procedures, which aren't always covered by NHI. International coverage. Some private plans provide coverage outside South Korea. In case you travel abroad, private health insurance is available from international providers e.g., Cigna, Aetna, or Korean insurers e.g., Samsung Life, Hanwha Life. Expats can purchase it through an employer or independently. 3. How to access healthcare as an expat. Healthcare in South Korea is widely accessible, and services are available at both public hospitals and private clinics. Public hospitals. Public hospitals are generally more affordable, but may have longer waiting times. They are funded by the government and are widely spread across the country. Private hospitals and clinics. Private hospitals and clinics often have shorter waiting times and may offer higher-end services. They tend to be a bit more expensive, but for many expats, the extra cost is worth it for faster care and more comfort. Finding a doctor. Language. Many doctors in South Korea, especially in larger cities like Seoul, speak English. However, in rural areas, English may be less common. It's a good idea to ask your healthcare provider if they have English-speaking staff or use a translation app. Booking appointments. Many hospitals and clinics allow you to book appointments online or over the phone. It's advisable to call ahead to check availability. Walk-ins. Most clinics accept walk-ins, though appointments are often preferred. 4. Costs of healthcare for expats. Healthcare costs in South Korea are generally lower than in countries like the US, but prices vary depending on the treatment and facility. Outpatient costs. Doctor's consultation. A typical consultation at a clinic costs around $10,000 to $30,007 to $25 US. Prescription medication. Medications are usually affordable, with costs ranging from $1,000 to $10,001 to $8 US for common drugs. Inpatient costs. Hospital stays. If you need a hospital bed, expect to pay around $100,000 to $300,000 day, $80 to $250 US, depending on the facility and level of care. Emergency care. Emergency visits. Emergency care is available at hospitals 247, but the cost can be higher than a regular visit. The initial emergency consultation and treatment can cost anywhere from $30,000 to $100,025 to $80 US. 5. Dental and vision care. Dental care. Basic dental care, such as fillings or cleanings, is not fully covered by NHI. You can expect to pay $30,000 to $100,025 to $80 US for basic procedures. More advanced treatments like orthodontics can be much more expensive. Vision care. Eye exams and glasses are available at clinics and optical shops. But NHI doesn't cover eye exams for glasses. Expect to pay around $20,000 to $40,015 to $30 United States dollars for an eye exam. 6. How to get prescriptions. Getting medication after seeing a doctor. You can get prescriptions at the pharmacy. Pharmacies are usually located near hospitals or clinics. Some pharmacies may also have English-speaking staff. Refills. If you need a refill, you might need to return to the doctor for a follow-up consultation, depending on the medication. 7. Medical services for children. Coverage for kids. NHI covers children, and many clinics provide child-friendly services. You can get vaccinations, checkups, and treatment for illnesses like colds, allergies, etc. 8. Expats experience and tips. Korean healthcare is efficient. Expats generally find healthcare in Korea to be of high quality and efficient. Translation services. Many hospitals in bigger cities offer translation services for foreigners. Or you can use apps like Papago or Google Translate to assist in communication. Pre-existing conditions. If you have a pre-existing condition, check with your insurer or the NHIS about coverage and any waiting periods. Conclusion. South Korea's healthcare system is comprehensive, affordable, and of high quality. Expats working in Korea will likely be enrolled in NHI automatically. Those without employment can join the system after 6 months of residence. While NHI covers most medical needs, some expats choose private insurance for extra coverage or quicker access to care. Whether you're dealing with a routine checkup or an emergency, healthcare in South Korea is accessible and efficient, making it a comfortable place to live and receive medical care.